you for waiting. We will go to the next session. I made the introduction only for 10 seconds, and we have the chairman of Japan Medical Association, Mr. Haruguchi. So I hope that you will make a brief remark. So please come to this side.
Thank you very much for the kind introduction. My name is Haranaka, President of the Japan Medical Association. The new executive leadership of JMA is faced with a major challenge, especially as Japan experiences unprecedented aging of the society, and at the same time, the birth rate has gone to extremely low levels. By 2045, at the peak, when elderlies reach a peak of the total proportion, will the social system be able to be sustained? And we are thinking what needs to be done in order to ensure stability and normality in the society. When we think about the health and protection of lives of the Japanese citizens, we must work together with the government as well as various private sector organizations and stakeholders, collect the wisdom to make the biggest contribution possible. Social structures have changed greatly, and the Japanese youth are suffering low levels of income, not being able to afford marriage nor having children. But we are working hard in order to ensure stability in the community, and we hope to continue our efforts in the basic need of protecting the lives and health. We're sure that Lancet Japan series will be a source of information as we strive forth, and we would like to learn much from the series. Thank you very much for giving me this opportunity to speak. Thank you.
Chairman Haranaka, thank you very much. From this point onward, I will ask Mr. Takemi to moderate. Without further ado, we will go to session 1. What does the disaster teach us about Japan's health system? Situation report will be done by Professor Kenji Shibuya of University of Tokyo. Thank you very much, Dr. Takemi. Ladies and gentlemen, thank you very much for coming to this event. My role is that I am setting the stage because this is session 1. So my presentation is introductory remark, especially since the great earthquake of March. What is going to be the implication on our healthcare system, strengths and weaknesses? On the day of earthquake, I was in a high floor of a big building, tall building. I was very scared. It shook very much. Richard Horton and Bill Summerskill immediately sent a message asking whether I was all right. They were the first, and the message said that what about postponing the issuance of the Japan series? I have strengthened my conviction that we have to work even harder to do it on schedule. Now, my PowerPoint is only one slide, one picture. This was taken in a village called Iidate village in Fukushima Prefecture. This is how the health check is going on. Iidate village is one of the most famous villages in Japan these days. You have been there? I don't know. Not so many people have been to Iidate Mura, but it's a beautiful place. For example, European, foreign tourists, when I explain, it's like a Toscana of Italy. It's a beautiful scenic beauty, and the local production of the food is very good, and they have the slow food movement. Since many years ago, this place was famous, but because of the earthquake and because of the concomitant nuclear disaster, this is only 30 kilometers away from the nuclear power plant. It place outside the evacuation area, but because of the wind direction and the rainfall, a lot of radioactive substances fell on Iidate village. Within Fukushima Prefecture, this area suffers from high level of radiation. It was detected, and conversely, now Iidate village is known for that. Kanno-san is the village master, and upon his request, towards the end of May, I went there and we conducted a health check. The village master, Mr. Kanno, asked us to go, and what he emphasized was this. One thing is that please take your time and please listen to the stories of the villagers. They have the nuclear power plant, and this was end of May, and in two months' time since the disaster, but they did not have a proper opportunity of seeking doctors. And they were they had a serious anxiety about their health and about their future. So the village master's request was that we remove their worries. So we tried to do our best in spending a good time. This picture is at the reception. Our students are asking questions to the villagers. One photograph, it's very simple. It's a simple picture of a health check. Villagers and students are seated across from one another. Actually, in this picture, you can find the past achievement as well as the future challenges. You can see that. What do I mean by that? Let me explain. First of all, at the left end of the picture, old lady. This is a hypothetical story. Let's call her Mrs. Sato. Now, Sato-san is 86 years old, and Madame Sato, before the earthquake, even at the age of 86, for 8 hours, she worked in her farm, and she took care of the beef cattle and dairy cattle, and she was very active. She had been active for the past 50 years. Madame Sato can be the epitome of the success of the healthcare system of the past 50 years. For the past 30 years, Japan has the longest longevity, and especially women. Ms. Sato is 86 years old. Japanese women's average longevity is renewing a world record. And at the top, Ms. Sato is covered by healthcare insurance. Even if she becomes sick, it does not cause any financial catastrophe in her household income. Whenever she wants to seek a doctor, she could go and she could seek consultation. But viewed from the world's people, it is something enormous. It is something quite remarkable. Universality and the equality. Mr. Horton and Mr. Takemi referred to it. And these were the basic norm of Japanese healthcare system. So very good insurance outcome was produced, maintaining the health equality. And this is a miracle. And how did we achieve it? What was the reason for achieving that? What are the current challenges? It is a big domestic issue, but as Mr. Horton repeatedly said, it is going to be a global issue too. It is the focus of great attention. Madame Sato, Grandma Sato, in Iidate village, she had 2 daughters and 4 grandchildren. And she had a very happy life. At the age of 86, she can move, she can do her work. But after the nuclear disaster, younger couples and grandchildren all evacuated, and everything changed. Everything became derailed since then. And she had to do everything because her daughters are gone. And in the vicinity, there was Madame Yamada. She cannot walk. And they have to look after themselves, too. And Miss Sato, there was an ambulance. And there were doctors in primary care and nurses, but there were no such services available. And then there was one village doctor, but this doctor was very old, so the clinic was closed. So she suffered from hypertension and high cholesterol. Well, blood pressure was well controlled for some time, but cholesterol before the quake, maybe she was not checking it properly, and the number was not so good. After the disaster, she was evacuated in-house, and then the clinics were closed. She was very anxious. Blood pressure was relatively high. Madame Sato, the BBC interviewed her, and the radiation and its impact was asked by BBC, but she had no knowledge, no information about the radiation level. After the nuclear disaster, for example, a person like Madame Sato, there are so many like Madame Sato, and for 50 years she tended her garden, her farm, her family members, pets, and animals. Everything she built, everything was lost. And for 2 months after the disaster, she had no opportunity of seeing a doctor. And there was no one to take care of her. And she doesn't know what is going to become of her income. And then she's worried about the possible increased premium of insurance. So it was the disaster was instantaneous, 11th of March. But actually the system was very fragile, and the disaster sort of exposed the problems that our society faces. We have an aging problem, and the problem of maintaining universal health insurance, and the quality of medical care. These issues, challenges would be discussed in the next session. But because of the March disaster and because of the ensuing accidents, including nuclear, these problems did not crop up immediately. Actually, these problems existed before the disaster, and earthquake sort of triggered the exposure of these problems. These problems cannot be so easily resolved. What should be the funding source of the reconstruction and the healthcare insurance system revision is in a dire situation because of the fiscal situation. In terms of the reform of the healthcare system, we have two other problems. One is information. Look at this map. This map shows you the area within 30-kilometer radius of a nuclear power plant evacuation area. At the same time, estimated level of radiation is shown. Estimated amount of radiation emitted, released from the nuclear power plant, and what would be the estimated level of exposure. Iidate village is actually outside 30K radius, but at the day of the explosion, hydrogen explosion, a lot of radioactive materials precipitated in this village. Actually, this information is made by SPEEDY, which is an acronym, but it's not SPEEDY at all. It was made available 2 weeks time after the accident. When I think it was around 15th of March, and the 12th of March, if a hydrogen explosion happened, if this information were communicated to them, then the situation would have been different. Maybe you think that the nuclear disaster is unrelated, but the disclosure of information is very serious in the field of healthcare. In order to do that, you have to accumulate data, and it has to be sorted out in an easy-to-understand way and disclosed to the people and reflected by the policy. We have to have a mechanism like that. But Lancet, Japan's special series, is going to concretize this flow of information. And this is something strongly demanded of Japanese policy. And what becomes the problem after information is the human resources. Take Fukushima prefecture. The doctors are fleeing from the prefecture. Now you see the map of Japan. And the number of deaths above the age of 75 per 100 per one doctor. This is based upon the estimation by our colleagues from Tokyo University, but I think it is reasonable. The more red the area is per doctor, you have more mortality of the people, more than 20 people above the age of 75, on average, of course. Tohoku area, as mentioned by Mr. Takemi, it is thinly covered with medical services, and aging is progressing, and quality healthcare is not something accessible by Tohoku residents. But is it limited to Tohoku region? I wonder. Now, this is another map. 2030 to 2035. This is the result of the simulation. It's the red area is not only Tohoku, Hokkaido, Kanto region, or part of Kansai is colored red. So it means that there is a high mortality of the people above the age of 75. It means that the aging progresses a lot. Now, what this map shows you is that in the case of the healthcare for the elderly, especially at the primary care level, the status of healthcare, how is it implemented? What are the human capacities available to look after that? There is a major paradigm shift. So this is the current situation. Tohoku region, red, colored red. 20 years hence, it is redder. So the disaster area is Tohoku, and what we observe in Tohoku now is one of the scenarios that we can write about the future of Japan. And to rephrase that, we are at the forefront of the world's aging, and we are the future image of the global healthcare. The fiscal situation, information, and health personnel. In the course of the reform of the healthcare system, these three are the major problems. Actually, in 2008, when we organized Toyako Summit, healthcare system strengthening was mentioned. Mr. Yamamoto and Richard and Takemi-san helped greatly. So fiscal situation, information, and the human capacity were the common problems in discussing the global health. So from Tohoku region, we can consider the future of Japan, and this is going to be a precious opportunity for thinking about our situation, and this is going to be a great testing stone for leading to the global health. I will conclude very shortly. I said that I have only one picture. Again, this picture of the health check of the villagers. Now, I said that in this picture, I said that so many things about our healthcare system is shown. Toward your left, you see younger people, our students. Since the onset of the earthquake, a lot of young people went to the disaster area to help. Or sometimes they communicated using social network and social media like Twitters and so forth, Facebook and so forth, and they have worked so outstandingly for the information dissemination. These are the dedicated young people working in the area of healthcare. So they are the future. Now we are here. There is a common question, very important. As Dr. Takemi said, good health outcome must be delivered at low cost with equality. And this system has to be carried on by these young people. Can we do that? Towards the right-hand side, we have Madame Sato, 86 years old. And can they live until the age of 86 in good health? When they want to see doctor, can they go to a doctor at any time they want? Can they receive a quality medical service? We now have the universal health insurance system. This is the 50th anniversary. Now, 50 years from this year, do we think that we'll be able to provide this system that we enjoy now to these young people now? It all depends upon every one of us here in the auditorium. So it's been 50 years since the establishment of the universal insurance system. So this is the time that we should start thinking from a Tohoku disaster area in thinking about the future of Japanese healthcare. Now, a magazine called Lancet. In 1823, Thomas Wakely began this publication, Surgeon. The motto is that you have to enjoy the readers, educate them, and reform them. Entertain, inform, and reform readership. So that is the motto of Lancet. So we would like to go along with that motto. In this conference, first of all, you should be entertained. And then you should discuss and you should exchange a lot of information. And if possible, joining hands, we should move on to the future reform. Thank you very much.
渋谷さんありがとうございました。
Thank you very much, Mr. Shibuya. So we will go to comment.
読売新聞の田中修一さんからまず最初のコメントをお願いします。どうぞ。
Mr. Tanaka of Yomiuri Shimbun Newspaper Company. Thank you very much. My name is Tanaka, Health and Medical News Department of Yomiuri Shimbun, and I'm most grateful for being invited here. When the Great East Japan earthquake occurred, 100 journalists and photographers were sent to the affected areas from our newspaper company, and the first impression, with the earthquake, many medical institutions suffered from damage. And to assist there seems to be a great gap, inequality in terms of assistance to the medical institutions. Red Cross Hospital or Social Security Hospital, now these group-affiliated hospitals were helped by their colleague hospitals who provided physicians and nurses. On the other hand, there were hospitals who received no support whatsoever. Ishinomaki City of Miyagi Prefecture was very much wiped out of the tsunami. There is a psychiatric hospital called KI Hospital, and 79 patients were admitted, and 24 of them had passed away as a result of the tsunami. 1 week after the earthquake, our journalists visited this hospital, and the bodies of these 24 patients were still there without having been treated in the hospital beds and corridors, even after 1 week. And the surviving patients were living on very little water and bread, and no physicians had been sent from other areas for support and assistance. So those hospitals that were outside of the network had not had access to any support. So this is a great challenge on how we can help these out-of-the-network hospitals. Next, let us widen the horizon and think about the overall system of medical services in the total affected areas. As has been mentioned by several, the aging of the society has progressed, and this is also an area where there are very few physicians in comparison to other regions. And that problem even deteriorated after the earthquake. It's not just aging and the few number of physicians. This is not the only region that is experiencing those challenges, so it is sort of a model for Japan as a whole, because it is going to be experienced by other regions. Now, it's going to be very difficult to build everything back to where it used to be, because these were rural and remote areas, and even before the disaster, there had been plans for consolidation of medical institutions, and therefore it would be difficult to rebuild all of the medical institutions back to what it used to be. And also, there was shortage of physicians to begin with, and therefore it's going to be extremely difficult to ensure sufficient numbers. So there has to be a new system of medical services, unprecedented and new innovative system. And that could be a model of Japan, as mentioned by Professor Shibuya. And also, all countries are faced with the challenge of aging, and therefore it could become a model for the global society. Then, how can a new medical system be constructed? First of all, one thing could be said without any doubt. Medical institutions alone can no longer support the medical requirements of those areas without any collaboration. Social or welfare facilities and hospitals and family care had been divided, and no collaboration had existed in between. And in the affected areas, hospitals, nursing homes, special long-term care facilities, social welfare facilities, and family care must all be integrated for comprehensive services to be provided to those in need. And visiting nursing station will have to be built as well. And The Ministry of Health, Labor and Welfare have allowed for special measures with regards to visiting nurse stations. There has to be at least 2.5 nurses for such station to be established. But now they allowed for a special measure for such station to be built even with one nurse. And as a result, a few visiting nurse stations had applied for certification. But the local communities had rejected, saying that that's not necessary. That's because so far, community medical services had been mostly provided by the community hospitals, and therefore the municipalities have not been able to depart from that conventional thinking. So the municipality officials have to change their mindsets as well. That's one thing I felt. Then, thinking about the new medical services system, how could this be rebuilt? First and foremost, we need to solve the shortage of physicians. In comparison to other countries, physicians in Japan have freedom. They are allowed to go anywhere to provide for practice. There is freedom in terms of specialty as well as a place of practice, and that is why especially young physicians tend to concentrate in large cities, resulting in shortage of physicians in smaller cities. In 2008, we made a proposal on medical reform, and this was featured in our newspaper, and there has to be planned allocation of physicians to all regions around the world. That was one of the proposals or suggestions we made. And in Western countries, that's already been done. For example, in France, training of physicians will depend on the scores they obtain in national qualification exams, and they would be allocated certain regions within the nation. And in Germany, by region, they would have a system of transfer of physicians so that the number of clinics would be limited region by region. And these policies are necessary in Japan as well, and that's what we recommended in our newspaper. Further, physicians are the sole occupation providing for medical service or treatment, but we also should expand the roles to be played by paramedics, pharmacists, and nurses as well. That was another suggestion. And in the affected area, this planned appointment of physicians and larger roles to be played by non-physician medical experts have become quite important. Then, under the Democratic Party of Japan-led government today, would it be possible to establish a new medical services system? That's the final point I would like to think about. Now, first of all, they're advocating increasing the number of physicians, but this was a policy that already began back in the Liberal Democratic Party days, and it's not a decision made by the Democratic Party of Japan. And also, the current shortage of physicians is partly caused by the excessive cut of medical expenditure. Last year, for the first time, at the time of the revision of drug price, there was a positive growth. It was only 1.9%, but there had been certain positive impact. But next year, the next revision of drug prices and medical services will take place, but it is uncertain on what conclusion would be reached because of the fiscal tightness the government is faced with. And also under the DPJ government, they've advocated that medical services is a growth industry. However, they have not come up with any specific policy on this matter. And in the manifest of the DPJ, in order to solve the shortage of physicians, usage of non-physician medical experts must be promoted. That they say, but they haven't come up with specific measures yet. It's already 2 years since they took the government, but we have not yet seen much results or progress in terms of medical policy or health policy. And unfortunately, under the current government, it's because health policy is not given high priority. So, in order to reconstruct the medical services and health policy in the affected areas, as the DPJ government, how do they establish a new system? They have to have a strong leadership and determination. Parliament member Furukawa said that they will live up to the challenge of establishing a new health system. And we truly hope that under the new Noda government, the administration will prioritize a new health system, establishment of a new health system. Thank you very much.
ありがとうございました。ちょっと時間もタイトに。
Thank you very much. Time is running, so going on to the next speaker, Professor Michael Reich from Harvard School of Public Health. Good morning, ladies and gentlemen. This is Michael Reich from Harvard School of Public Health. How do you do? In today's meeting, I understand that most of the attendees are Japanese, so I would like to speak in Japanese. There are three sets of comments that I would like to make today, especially from the perspective of politics, the economy, and ethics. Presentation by Dr. Shibuya was extremely interesting, and I think it involved various levels and sectors, from the individual to the national government. And this includes the prefecture, and it includes various communities. And so let us think what the common theme is. I would like to briefly talk about the three common themes that were mentioned. Number one, we must take into consideration the status of politics and the economy. To consider the situation of the Itatehe village and the aftermath of the Great East Japan earthquake, and think about the current status of the Japanese healthcare system, we must also consider the current status of politics and the Japanese economy. These issues are not simply technical issues, but also political issues as well as economic issues involved. As was commented by the previous speaker, currently Japan faces political instability without economic growth, making it extremely challenging to solve the issues of the health care system in Japan. On the one hand, amidst the state of flux, there is larger possibility of reform and change. There is a great window of opportunity. This can trigger policy reform going forward, possibly. So that's the first point I would like to comment on. The second point, we must make clear the ethical justifications of various changes based upon ethical analysis and assessment. The general principle says that when allocating limited resources, we must come up with a clear ethical justification to do so. First of all, we must think to whom shall we provide assistance to, how much assistance to provide, and where to source the funds from. How do you explain to the citizens the legitimacy of such resource allocation, and how do you convince them? The Lancet series on Japan explains that the ethical concept of human security should be the basic principle applied. But more specifically, how can we use this concept to solve issues of Itatehemura village, and also, as mentioned by Dr. Shibuya, how do you solve practically the issues faced by Madam Sato? The third point, who should solve these issues and take responsibility? Should there be a division of role between the central and the local government? How should that division of role and responsibility be? The Japan series of Lancet indicates that the local government should take a more active responsibility. However, how can a local government implement what cannot be even conducted by the central government? For example, It is said to be very important to communicate accurate information to citizens based upon a scientific analysis. As was in the case of the Great East Japan earthquake, one of the major challenges of the Japanese central government is to communicate scientific analysis and information. And as was seen in the response after the disaster, there was much weakness in the response by the central government. So how can the local government be more active and be more effective in promoting reconstruction efforts? This challenge is deeply related to the discussion of decentralization, often debated in my area of political science. Local governments do not necessarily have the appropriate level of capabilities. If the local governments lack such capabilities, then what should they do? Who's going to take responsibility to empower the local governments to gain such abilities? This type of issue will deeply impact the realization and progress of democracy in Japan. That is it. Thank you very much for your kind attention.
Professor Michael Reich, he spoke so fluently in Japanese. It was easy to understand, very clear presentation. Now, this session is under the title of What Does the Disaster Teach Us About Japan's Health System? Disaster hit directly the aged society. Many things happened, and that is going to be the microcosm of Japan in 20 to 30 years' time. In order to solve these problems, probably we shouldn't limit this issue as an East Japan problem. From the entire national perspective, we must look at the situation of East Japan in seeking further reconstruction and recovery. I think that is the grand theme of the discussion of session 1. We will go to session 2. I know you are very tired, but we will not have any coffee break, and